Good morning, I'm Frank Powers, and this is Lifestyle Tucson, the program where I speak to our neighbors, the people behind the scenes of our amazing organizations that are 501c3 nonprofits. Our friends are informing you how they serve our community, and they are here to give you updates on future projects. Let's make some new old friends today. Yeah. The American Heart Association's signature women's initiative, Go Red for Women, is a comprehensive platform designed to increase women's heart health awareness and serve as a catalyst for change to improve the lives of women globally. It's no longer just about wearing red. It's no longer just about sharing heart health facts. It's about all women making a commitment to stand together with Go Red and taking charge of their own heart health as well as the health of those that they can't bear to live without. Making a commitment to your health isn't something you have to do alone either. So grab a friend or a family member and go red today. Because today, I'm fortunate to speak with two co-chairs for Go Red for Women's campaign. Dr. Sandy Stein, Chief Medical Officer with Banner University Family Care. Doctor, welcome to Lifestyle Tucson.
Thank you so much.
I'm very excited. I always love talking to doctors. As well as Sarah Spiekermeier, Interim CEO of Banner University Family Care. Sarah, welcome to Lifestyle Tucson.
Thank you for having us.
I'm very excited to talk all about this. And we just realized outside that we did this a couple of years ago. That's right. We had a great conversation about this event, about the importance of it, and about what we're all going to be doing. And let's just get right to it, because we're going to be hanging out when we Go Red for Women on Thursday, September 18th from 10 a.m. to 1 p.m. at the beautiful Westin La Paloma Resort. Can you tell me all about this big event that we've got going on?
I absolutely can. What is Go Red for Women? For 21 years, the American Heart Association's signature women's initiative, Go Red for Women, has met the evolving healthcare needs of women and addressed awareness and clinical gaps of their greatest health threat, which is cardiovascular disease. Go Red for Women is a source of credible health solutions at every age, stage, and every season of life. Cardiovascular disease does not discriminate. It is not a one-size-fits-all. It's a complex as women are. Health is deeply personal, and it's heart disease that unfairly targets women. Women have been left out of many things, including research, testing, treatment, and even significant funding. And this is a surprise to many people. Cardiovascular disease continues to be the number one killer of women, claiming more lives than all forms of cancer combined. And most people think it's cancer and breast cancer that's the number one killer. So we want people to understand that. Nearly 45% of women over age 20 are living with some form of cardiovascular disease. Go Red for Women is dedicated to connecting women together, motivating women, educating them to inspire each other. Because when we go red together, we have the power to build communities and foster better lives.
Bravo. Well said. Well done. My goodness. And she was nervous about being on the radio for a moment there, and we were getting started. My word. So that's what it is all about. And it's going to be a great event. And it is like your signature event. So why don't we get into the details of what people can expect on September 18th at 10 a.m. It is a Thursday, so make sure you put it in your calendars. What's going to happen at this big, great event?
Oh, we've got a lot planned for the event. The Go Red for Women luncheon is a powerful and moving experience with educational sessions about women's heart health that will take place before the luncheon. Guests will also learn about the association's impact to Southern Arizona. After the lunch, a passion speaker, Elizabeth B. Juneman, will address everyone. Elizabeth is a professor of medicine at University of Arizona College of Medicine and also the director of cardiology clinical operations at Banner University Medical Center right here in Tucson. So join us the day to focus on prevention of heart disease and stroke, sharing stories of people impacted by cardiovascular disease, and raising critically needed funds to save more lives.
Amazing. And we can all register right now if you go redforwomen.org. So very easy to find. There's lots of stories there. There's blogs. There's resources online and a lot more information. And you can always make a donation if you can't go. Because you know what? If you can't donate your time, why don't you donate some funds and help this great organization out? Because they're doing a lot to help out all of these folks that we live with called women. Yes, that's right. I can't believe the statistics that you do talk about, because it is quite the thing that it's like 1 in 3 deaths each year can be really attributed to this big problem of cardiovascular disease. And it's really important to pay attention to our bodies and pay attention to this stuff. And we don't all have a nagging spouse to make sure, why haven't you gone to the doctor? That's why you have to have folks like me nag you to do this, because it makes me do it as well. I found out in the last couple of years, I have a bit of a heart issue. Isn't it ridiculous to find this out as we age? I hate it. So I've been taking care of myself and doing what I can to make sure I'm in better health, to make sure that I am more aware of what's going on, to not ignore any symptoms or signs of these problems, because we can get some of that and maybe, oh no, it's probably just agita, or maybe it's gas. No, it's not. It's a big problem. So what are some of the resources that are going to be available at this big event?
Of course, we're going to have so many great things at the event. I think we're going to be doing CPR as well. We can train folks in CPR. There's going to be so many great clinicians and advocates in the room for it. And I love that you even shared where you said you have to, nagging yourself. I mean, as women, we're so used to nagging all of our family about how important heart disease is. And I think this is a great opportunity where, Sandy, as our friendships bloomed, we've got to keep each other accountable and make sure that we're taking care of ourselves as well.
Absolutely. And there's going to be basic information about cardiovascular disease so women really understand the symptoms and understand the preventions. And there'll be empowering ability to learn and hear from stories about survivors.
That is what's the most inspirational thing and gets you motivated to know it, because when people tell those stories, that might sound something like I'm dealing with, and it gives them a little bit of a hint as to what might be going on with themselves. So it's really important to attend these things, get educated, get informed, and meet people that have dealt with this sort of stuff in their lives so that you don't have to deal with it, not alone, because that's what's important too about getting together at a big event like this and having that community. Tell me a little bit about some of your memories from the past of this event and why you think it is as successful as it is and why it is so important to go to and attend this big event.
My memories of the event are getting together with a group of mostly women. There are some men that attend, but to hear those powerful stories, to get educated, to talk from the perspective of a community and to really learn together. And I think the most exciting thing is to meet people, to make relationships, and to continue to build communities after the day of the event and keep on making a difference.
Absolutely. That sounds great. What about you? What do you think is some of your favorites from anything in the past?
I just echo that, Sandy. I think the relationships I've made since my involvement with American Heart Association here in Southern Arizona, I was so focused on heart health for my husband, my father, my grandfather. I did not know how much it impacted women, and I've learned so much from that. And partnering with Dr. Stein and others, I've learned that it shows up different in women. So I'm more conscious of my own health from going through this and met so many amazing people along the way, because we're the ones, the voices that are going to get it out there. Right, Sandy?
Absolutely. And I wanted to piggyback on Sarah's comment about how cardiovascular disease presents in women. It's very different than that traditional crushing chest pain from a heart attack that you expect to hear in men. Women often are underdiagnosed or not diagnosed at all and really brushed off at just having anxiety. Often women present as having symptoms of shortness of breath. They may have nausea, vomiting, stomach pain. They may have just extreme fatigue, lightheadedness, headaches, or anxiety. And these things are critically important and can't be ignored.
No, they shouldn't be. And again, if you are feeling any of these things right now, what would be any advice that you have for anyone listening that you might be, someone sitting there going like, uh-oh, and you might be actually kind of keying them in. It's like, maybe this is the 10th time I've heard this. Maybe it's time to do something.
If somebody says, uh-oh, there's something that's not right, if it's acutely not right, certainly we always want people to go to their primary care physician routinely to be able to talk about things. But if that day they think something is really different and not right, they should go to an emergency room to make sure they're not having a heart attack or a critical event.
That's right. Don't be stubborn. Go to the doctor. It's very, very important to be sure that you're taking care of yourself and listening to your body, listening to these symptoms. And when someone's on the radio, a doctor telling you, are you feeling this? Are you feeling that? Are you feeling some of that? And you are, well, then take note, because then this is a sign that it might be time to get involved and get informed about what's going on with your body. And you can do that at this great event, the Southern Arizona Go Red for Women event, Thursday, September 18th at 10 a.m. at Westin La Paloma Resort. It's going to be a big, big day. I believe for more than 20 years it's been going on. So it's really important to make history again and join them so that you can make some new friends and find the community that you need so that you yourself are healthy and feeling good. Let me ask any other questions or some of the other stuff we were talking about off air. Want to discuss some of that real quick?
Absolutely. It's critical to understand the risk factors for women associated with cardiovascular disease. Certainly knowing your numbers. So blood pressure, do you have high blood pressure, high cholesterol? Do you have high triglycerides? And certainly diabetes, obesity, a family history of cardiovascular disease, drinking large quantities, smoking, inactivity, and most of these things are preventable, at least to some extent, and 80% of cardiovascular disease that's serious is preventable. So doing things like eating healthy, getting in motion, not smoking, trying to decrease stress, which is a whole lot easier said than done, are things that can have a profound impact in your life and those around you.
Yeah, especially if you're still smoking. Come on, what are you thinking at this point, at this stage in the game? I hate to hear how the vaping has gone up in kids. The smoking is so drastically down in children. It was going down, but then that vaping showed up. Any of you folks around my age still smoking cigarettes, it's time to realize that we got a lot of new information about that, and you're the one harming yourself. So you really got to do your best to maybe make that New Year's resolution now. Get ahead of the game and quit smoking, because it's just going to be the best thing for you. If you're waiting for a sign, this is it. Quit smoking, put those cigarettes away. They cost so much nowadays anyway. My goodness, you don't want to be paying that. Paying to die? No one wants to do that. You want to donate that money to a great organization. But you do. You want to go make a donation. You want to go spend some time, spend some money on this great group that's doing so much to help so many ladies here in the area. So now, just give me some more about the event that's going to happen. Any other little details about it before we wrap up, because we do have a short time together today. But I really appreciate you coming down.
Yeah, a little bit more. You can get tickets are $150 each. They can be purchased at soazgored.heart.org. And if you can't attend, you can always donate. As you're sharing, you can donate on the site as well. And events like this can't go alone without having supporters. And for this event, our national sponsor is CVS Health, and local sponsors include us, Banner University Family Care, Arizona Complete Health, Encompass Health, Sonora Quest Laboratories, TMC Health, and Arizona Lotus Corporation.
Hey, that's us.
That's you guys.
And we greatly appreciate the support of your station.
Heck yeah. I always love talking to everyone here at Banner and talking to doctors, the real superheroes in the world, saving lives. And it's really important, because I'm hoping that even the little bit of information that we shared today might have saved a life. Because remember, knowing's half the battle. And now you know a little bit more, even though, again, that's not a secret on how to take care of yourself. It really is just about staying informed, getting involved, and paying attention to the signs that you are displaying when it comes to your own body, and keeping aware of what you're putting into your system. So any last little calls to action to anybody?
I think the call to action is exactly what you said, being aware of what you're putting into your system and moving. Movement can be the most impactful thing from a cardiovascular perspective, from a mental health perspective, that has a profound impact on cardiovascular health as well.
There you go. That's exactly right. And I appreciate you coming down. Thank you so much. It's all good advice. Listen to it. She's a doctor. Because today we made friends with Dr. Sandy Stein, Chief Medical Officer with Banner University Family Care, as well as Sarah Spiekermeier, Interim CEO of Banner University Family Care. Thank you both so much for joining me today.
Thank you.
Thank you so much.
This was Lifestyle Tucson. Bing bong bing, time for a recap. What a great conversation. I do love talking to doctors and talking about health, hopefully helping some of you out there with your health and trying to motivate you a little bit, because that's the type of guy that I am, and I really do care about the people in our community, making sure that they're healthy. And I want to also emphasize that, remember, I've been calling it an event, right? But it's the Southern Arizona Go Red for Women Luncheon. It's a delicious lunch. There's a vendor fair, educational breakout sessions, the program, the lunch speaker that's going to be there. It's going to be a big, big deal. Tickets are $150, but they go to the great cause of this organization. Again, another way to donate is maybe buy a ticket for someone else. You don't want money to be a barrier when it comes to health. So if there's someone in your life that you can donate so that they can get a ticket to this, maybe that's a good way to make a donation, is buy some tickets for folks in the community. Tickets are $150. They can be purchased at soazgored.heart.org. And if you can't attend, make sure to donate as well. We hope to see you down at the beautiful Westin La Paloma on Thursday, September 18th for Southern Arizona's Go Red for Women. Thanks again to CVS for sponsoring this big event, and thanks again to Banner University Family Care for always come down here, have a great conversation with me on Lifestyle Tucson. So I want to thank our old friends at Banner University Medicine for joining me today. You've been listening to Lifestyle Tucson. If you're a nonprofit that would like to be on the show, email lifestyletucson@gmail.com. For more information about this program or to listen to something you may have missed, go to the Sunday Mornings page on klpx.com, kfma.com, mixfm.com, crankthehangtucson.com, or espntucson.com. You can also subscribe on iTunes, Spotify, or wherever fine podcasts are full of heart. Follow on Facebook, Instagram, and YouTube at Lifestyle Tucson, because I'm your BFF, your best Frank forever, Frank Powers. And toot toot Tucson, I love you the most.